Alright, so today what we're going to be doing is we're going to be working on massage techniques, draping, and a little bit of anatomy of the posterior thigh and gluteal region. Okay, so the first thing that we're going to do is we're going to set up the drape in a manner that is going to access all the muscles of the leg first. Okay, we're only going to expose the glutes when we actually need to. Okay. For the most part, we want to leave the glutes covered just to save a little bit of privacy for the client. Okay, so we are going to separate this blanket sheet a little bit here. Bring it right there in the middle. Now we can do this drape the same as we did on the anterior leg. We can do a diaper drape. We could also keep it just tucked in underneath the other leg, which is a little less secure. Okay, and you may have to continuously readjust it. But the diaper drape, as simple as this. Bring the sheet right here in the middle between the legs. Lift up underneath the knee. Bring it forward. And tuck it taut. Alright, so now we have as much area of the leg exposed as possible. You can cover the arm back up so that it doesn't get cold. And now we can proceed. So basic anatomical position is she is in a prone position. Her knee seems to be fairly relaxed. Greater trochanter would be located right into here. Posterior knee. Muscles on the posterior knee, this would be the hamstrings. You have the biceps femoris, the semitendinosus, and the semimembranosus. Also back here, you're going to have the gracilis and also the adductors on the medial thigh. On the lateral side, we would have the IT band or the iliotibial band from the iliac crest down to lateral tibia. The superior aspect, right into here, we would have the tensor fascia lata, which is the attachment of the superior aspect of the iliotibial band. General application of massage would stay consistent with the other areas of the body. 5 basic techniques would be effleurage, petrissage, friction, vibration, and tapotement. We're going to start by applying a little bit of lubrication to the posterior leg. We're going to use an effleurage technique to help spread the lubrication and warm up the tissues. Now be careful with how many times you go right over the posterior knee. This can be a sensitive area and it can get irritated rather quickly. So lighten up when you go back behind the knee and don't go in the same path over and over again. So we're going to address each individual muscle. First, we're going to go with the biceps femoris. We can find this by just flexing up the knee a little bit, find this lateral tendon, and we know it's going to be right in through here. There's definitely a little bit of tension behind it. Come right up through here. All the way to this ischial tuberosity, which is this common attachment for all the hamstrings. Right in through here, we're going to have the semitendinosus. And then that medial tendon, which is the membranosus, semimembranosus. A little bit of petrissage here to help loosen those up. Carry the petrissage into the medial thigh. When you're applying massage to this area, it's okay to use some decent pressure. don't have to be afraid. These muscles are overused pretty much on everybody, so they can certainly take some work. Now, as I'm working through it, I can feel how they're shortened, okay? So what I'm going to do is I'm going to actually readjust the drape as I do this, but I'm going to take her leg and I'm going to bring it off to the side of the table. What this does is it actually increases length. You can see how her knee is locked out. So now, since this is a lengthened muscle, I'm going to increase length just a little bit more by going in a cross fiber direction. I find where that definitive edge to that muscle is, and then I push and just glide through the muscle. Don't try to skip over top of it. Try to go through it almost. Addressing right around the knee as well, medial and lateral. Doing some circular friction on both sides. As I'm out here on the lateral side, I can feel how there's a lot of tension coming right up and through here. So I'm just going to get in there a little bit deeper, use my thumbs, and chase some of that tension away. If your hands get tired, you can always use your knuckles or your palms. This is another area where the elbows or the forearms can certainly come into play. Just be careful with how far up you go. Some clients may get a little apprehensive if you get too close to that sheet. And the last thing you want is your client tensing up while you're working, because that just makes more work for you. I'm addressing the iliotibial band on the side. Do some gliding techniques, palm, knuckles, fingertips. Just don't apply too much pressure because this is a sensitive area as well. There's not much tissue between the tendon and the bone. Doing circular friction. Jostle. Now, while we have her in this position, we can easily bring her heel up to the glutes. Now, this particular movement is going to create an anterior stretch on the quadriceps, more so in the direct middle of the quadriceps, namely the rectus femoris. Now, if I would like to increase this stretch on the anterior hip, I could just simply put my hand here, lift up, and now we have increased the stretch. We can bring the heel up to the other side, which is going to bring that stretch a little more lateral. Or we can bring it the leg lateral and bring the stretch more medial on the anterior side. You can do some footwork in this particular region. A little bit of jostling. For the glutes, all we're going to do today as far as massage is we're going to do a kneading technique. We are going to work over this sheet. We're just going to make 2 fists, and then we're going to kind of act like a cat, back and forth. If you feel bone underneath of your hands, and lighten up. Don't apply as much pressure. You're not trying to kill the tissue. You're simply just trying to knead it. And try to find some rhythm to it. Alright, we're going to re-drape the leg. Do a nice little compression. Soak up some oil. And there you go. Thank you very much.